Assalamualaikum. It's me, Farooq Faria Javeen, roll number BP1650063 from Morning 4th Prof, group number 34, and my topic is chronic kidney disease. What is this chronic kidney disease? Chronic renal disease is characterized by progressive deterioration in kidney function, ultimately leading to irreversible structural damage to existing nephrons. Specifically, CKD is defined as kidney damage with a normal or mildly decreased GFR, stages 1 and 2, or a GFR below than 60 ml per minute per 1.73 meters square for at least 3 months with or without evidence of kidney damage, stages 3 to 5. ओके सीकेडी में बेसिकली हमारी किडनी के फंक्शंस में नॉर्मल फंक्शंस में डिस्ट्रक्शंस हो जाती हैं और हमारी किडनी प्रॉपर फंक्शंस परफॉर्म नहीं कर सकती और किडनी फंक्शन जो है वो हमारे जीएफआर पर भी डिपेंड करता है. जीएफआर इज ग्लोमेरुलर फिल्ट्रेशन रेट. अगर हमारे पास जीएफआर में नॉर्मल या माइल्डली डिक्रीज आ जाए तो इट विल लीड टू स्टेज 1 एंड स्टेज 2. बट if there is moderately or severely decreased in GFR, then it will lead to stage 3, 4, and 5. This stage 5 is called kidney failure. Now here are some causes of CKD. These are albuminuria, the presence of protein in urine; azotemia, the accumulation of nitrogenous waste such as urea, blood, urea, nitrogen, 1. Diabetes, polycystic kidney disease, interstitial nephritis. So the first cause of the CKD is albuminuria. ये वो कंडीशन होती है जिसमें पेशेंट्स के यूरिन में प्रोटीन की प्रेजेंस मौजूद होती है दैट विल अल्टीमेटली गिव राइज टू CKD. And then there is another cause of CKD, that is azotemia. इस कंडीशन में हमारे बॉडी के जो नाइट्रोजनस वेस्ट होते हैं वो हमारी बॉडी से एक्सक्रीट होने के बजाय हमारी बॉडी में एक्यूमुलेट होने लग जाती है. इस एक्यूमुलेशन की वजह से हमारे पास चांसेस बढ़ जाते हैं कि पेशेंट को CKD हो जाए. Okay, then we have some other causes, that is diabetes, polycystic kidney disease, that is formation of cyst in the kidney, then interstitial nephritis, that is inflammation of basic structures of the kidney, and they all will cause CKD. Now here are some signs and symptoms of CKD. Particularly, we do not get any signs and symptoms in early stage. The following signs and symptoms are related to later stages of CKD. इनिशियली हमारे पास ऐसा कोई भी साइन एंड सिम्टम्स पेशेंट में नहीं दिख रहा होता. जैसे ही हमारे पास प्रोग्रेस कर रही होती है हमारी डिजीज तो फिर हमारे पास साइन एंड सिम्टम्स हमारे पास शो होने लगते हैं. ओके, these signs and symptoms are weight loss and poor appetite, tightness, shortness of breath, blood in your pee, that is urine, and increased need to pee. Mostly it occurs at night. Insomnia, itchy skin, muscle cramps, headache, swollen ankle, feet, and hands. Okay, the treatment of CKD. Early stages of CKD treatment is done by managing fluid and electrolytes abnormalities and other risk factors. Later stages of CKD, renal replacement techniques, that is hemodialysis, peritoneal dialysis, kidney transplantation. Okay. The early stages can be treated by reducing fluid and electrolytes in abnormalities and other risk factors, that is diabetes, hypertension, high BP, and so on. And the later stages of CKD can be treated by renal replacement therapies. The only choice is that hemodialysis, peritoneal dialysis, and kidney transplantation. Now here is hemodialysis. What is the hemodialysis? A machine filters waste, salts and fluid from your body. When your kidneys are no longer healthy enough to do this work, it is one way work to treat advanced kidney failure. Normally, hemodialysis begins well before your kidneys have shut down to the point of causing life-threatening complications. Okay. The hemodialysis is used for the patients having ESRD, that is end stage renal disease. This hemodialysis machine helps to maintain the patient's blood pressure, fluid, and various minerals in the body. Now here is my case study. Okay, RW, 55 years old man with a 25 years history of hypertension, renal insufficiency, presents to the renal clinic for reassessment of his kidney function. He is 70 inches tall and weighs 70 kg. Since his last visit 3 months ago, his creatinine clearance has decreased from 22 to 12 milliliter per minute, and the burn has increased 89 milligram per deciliter. The serum potassium is 4.5 milliequivalent per liter, and bicarbonate is 17 milliequivalent per liter. He has selected hemodialysis as his form of therapy until a suitable donor kidney is available, and is expected to begin dialysis within the next 1 to 3 months. When he begins dialysis, he will be dialyzed 3 times a week for 4 hours, each treatment using Fresenius F60S dialyzer with blood dialysate flows of 400 and 500 milliliter per minute respectively, and bicarbonate containing dialysate. What characteristics of Fresenius F60S dialyzer make it a good choice for RW? What determines the composition of the dialysate? Here is the soap notes. Subjective. The patient was male. His age was 55. His weight was 70 kg. His height was 70 inches. The reason for visiting the clinic was for reassessment of renal function, and medical history, hypertension, and renal insufficiency. Now here is the table of electrolyte composition of hemodialysis and their normal ranges. That is the normal ranges of these solutes in hemodialysis. And here is objective. The patient creatinine clearance is equal to 12 milliliter per minute, which is very decreased from the normal range, and the normal range is equals to 75 to 125 milliliter per minute. This is very decreased amount. And the burn is equals to 89 milligram per deciliter, which is a very increased amount from the normal range, and the normal range is 8 to 18 milligram per deciliter. And serum potassium is equals to 4.5 milliequivalent per liter, and bicarbonate equals to 17 milliequivalent per liter. These both are in normal ranges. So the assessment will be CKD occurs due to the decreased creatinine level and increased burn level. What will be the plan? Dialysis will be 3 times a week for 4 hours by using Fresenius F60S. Why are we using Fresenius? The Fresenius F60S is a high reflux dialyzer with large pore size, KUF of 40 ml per mmHg per hour, and in vitro KOA urea of 709. Here we are using Fresenius F60S as it has high reflux and it is made up of polysulfone membrane, which has larger pore size as compared to normal cellulose membrane. Okay, so the KUF here is the measures of the volume of water removed from the body per mmHg per hour, and this is equals to 40 ml per mmHg per hour of the F60S. And in vitro KOA can be defined as the capability of a dialyzer to remove urea from the body, and it is equals to 709, which is a very high amount, and it will be the good choice for the patient to choose F60S, Fresenius F60S. Okay, so the final dialysate solution by proportioning a dialysate concentration with purified water. Here we do not use sterilized water as the membrane separates the blood and dialysate compartments. So we do not use sterilized water here. We will use any any purified water. Okay, and dialysate composition standardized can be standardized with certain limits of electrolyte contents by balancing them, by normalizing them, or by keeping them in normal condition, in normal ranges. Okay. So here is the image of Fresenius F60S dialyzer. It is also available as F80S dialyzer, F100 S dialyzer, 50 and 40, and these. So that was all about my topic, and it has been ended. And thank you.